Is Dr. Greg Kolodziejczak, who is a clinical psychologist, and during this Mental Health Awareness Month, and also it's Borderline Personality Disorder Awareness Month as well, he is talking with us about that very subject, Borderline Personality Disorder, or BPD. Thank you so much for being with us, Dr. Greg.
Thank you. It's a pleasure to be here.
Let's jump right in, if we could, and start with a definition of borderline personality disorder.
Well, the most succinct definition would be a pattern of instability in interpersonal relationships, self-image, and emotions, and marked impulsivity. A lot of authors will characterize the symptoms into three clusters. One would be severe emotional dysregulation. Okay. Emotions are all over the place, sure. And in very painful ways. Secondly would be impulsivity, often with an aggressive tone to it. And the third would be intense, unstable interpersonal relationships. And underlying all of those is a fragmentation in the basic structure of what we call the self, or the personality structure.
Okay.
Two researchers, oh, go ahead.
No, I was just going to jump into sort of the characteristics of people suffering that. What are some of the things that we would be seeing from these people?
Well, you would see a lot of instability in terms of their emotions and their expression of those emotions. Two researchers out at McLean Hospital, Francis Frankenberg and Mary Zanarini, wrote an interesting article where they suggested that the essential nature of BPD is two things. One is an intense inner pain that they experience on a chronic basis. And secondly is awkward ways of trying to manage and express that pain. Okay. And that's what we see on the outside, is those awkward ways of expressing it. And so sometimes that might be lashing out in anger and rage. It might be just the cycle of being almost, kind of hypomanic one moment and severely depressed the next. It might be very destructive behaviors like cutting or suicidal attempts. BPD has the highest attempted suicide rate of any mental health disorder.
Wow.
So it's a very painful condition. Patients live in a lot of inner chronic pain.
Mm. And in getting into some of the ways in which someone with BPD would be treated, maybe if you could talk about that.
Sure. There's a number of treatment approaches that are sort of empirically validated now. But in general, I would say probably the first thing we want to do is help the person to learn more effective coping skills to deal with their pain, more effective interpersonal skills to manage interpersonal relationships. And that would encompass a wide range of things. How better to relate to their own internal experience, how to understand what's going on inside of them. Sure. A lot of people, not just borderline patients, but a lot of patients will only know I'm miserable. Yeah. They have very little ability to actually articulate that. And they really may not have been mentored growing up in how to understand and manage emotions. And so they just know, I feel miserable and I want it to go away now. Yeah. And so helping them come to a deeper understanding of what's going on inside and an ability to identify it, label it, and manage it is really helpful. So learning those coping skills, coming to greater insight and awareness of what is going on inside of myself, learning how to make sense of it so it doesn't just seem chaotic and bizarre. But okay, there's a reason for this. The more we can understand something and the more we can kind of manage it. There's a saying we sometimes have, name it to tame it. Yeah. And then the longer term work is going to be on healing and integrating the underlying self structure. All of us have this psychological thing we call the self. It's very hard to define. It's a bit like intelligence in that way. If you see someone who's very good at solving problems, we would say he or she is intelligent. If we see someone who is good at managing emotions, managing relationships, maintaining reasonable levels of self-worth, good self-agency. We'd say they have a strong, cohesive sense of self.
Okay.
In BPD, that's usually not the case. There's a fragmentation in the cell structure. And so to work with them in ways that integrate that and heal that is sort of the long-term work.
And can faith play a part in the person's treatment as well?
Yeah, definitely. I think that anyone who comes to a knowledge and I would specify a heartfelt awareness, not merely an intellectual awareness, but a heartfelt awareness of the love and the truth of God, that's going to be healing for anybody. Yeah. Now, the difficulty with that for patients with BPD is their human experiences make it actually harder to experience that love of God. And so very often there is healing that needs to occur on the natural level so that our nature can be fertile ground for the seeds of grace. Mm-hmm. But nonetheless, having that some awareness that there is a God who loves me and there's a meaning and a purpose to my life, and that life is not just this meaningless variety of events, but there's an order to it and a purpose to it. Finding meaning in life is often a difficulty for a lot of people, but very much so for people with BPD. I think that faith also gives us a moral compass that's very, very helpful and gives us a better way of dealing with the inevitable suffering that's in our lives. I mean, probably the things that are worse than suffering are suffering alone and meaningless suffering. Yeah. And very often patients with BPD feel that they're suffering alone and that it's meaningless. So the more we can help them feel connected in the suffering and find meaning in it, that's incredibly valuable.
Yeah. And we're just out of time. Greg, thank you so much for being with us. But I just wanted to ask you, if someone is experiencing symptoms of BPD, what would be the first step that they would take to reach out and get some help?
Well, they could reach out to a therapist. They could do some research. There's a lot of self-help material on the internet now. The problem with that is it's always a mixed bag. Some of it is really good, some of it not so much. There are a number of good books out there on borderline personality disorder. I Hate You, Don't Leave Me, Sometimes I Act Crazy, The Borderline and the Buddha, Get Me Out of Here by Rachel Reland. It's her memoir of recovery from BPD. Sure. So probably doing a little investigation in it is not a bad start.
Well, thank you so much, Greg, for being with us. We appreciate it so much during this National Mental Health Awareness Month. Thank you so much for being with us.
Thank you so much. It's a pleasure to be with you.